Okay, this is Summer McMurry with Carolina Pediatric Therapy, and I'm here with Kylie Jeffrey, one of our awesome OTs. And April is Occupational Therapy Month, by the way. I wanted to mention that. So, Kylie, thank you for coming today.
It's good to be here.
Yeah, Kylie's on our OT team here at Carolina Peds and has been a real all-star in jumping into telehealth. So I wanted to take a minute, and we're answering questions for families just about what can they expect in a teletherapy session and what activities we're using to just help to get children engaged in the therapy. So since it's a little different medium than a lot of our families are used to, because we typically are going into homes and into their daycares, or they're coming to us in our clinics. So the first question that I have is, what is one question that parents are asking you when they're getting started, and how are you answering?
So probably the most popular question I've gotten is just how to explain all that's going on with the coronavirus to their child, and just how, do we take this information and kind of condense it down into a way that kids can understand. So I've done a lot of different social stories and just discussions with the kids that I work with, just so that they can understand that, life doesn't look the same. It's a little bit different. It's not a bad thing, but we're just kind of adjusting our lifestyles.
Yeah, and how are parents giving you good feedback about how their children are responding to that?
Yeah. I have one family who the child just needs that social story to kind of understand, why can't we go to restaurants? Why do we have to grocery shop differently? And so she says it's been really helpful to kind of prompt him with that social story, just to read every time that he has a question of, why can't we do this? Why, if he starts to get upset about not being able to do something, she says the social story has been pretty awesome with just, a prompt and helping him process and understand that.
Yeah, well, that's really helpful to know. That is definitely, I think children are certainly feeling the anxiety over all of this, as their routines have all been changed, as well as adults, and the adults in their world feeling stress as well. They feel that.
Yeah.
Okay, so now that we are all at home and we're working from home and we're providing teletherapy, how are you preparing families for their first teletherapy visit? What are you telling them as far as, do they need to bring things to the appointment with you? How are you prepping them?
Yeah, so I've been using my first session with families more as like an exploratory session. So I just tell them, hey, this is teletherapy. We're going to try this. It's a new medium. Just come as yourself and just bring your child and just be prepared. I'll let you know if there's any materials I need you to have. And then so just kind of signing in, figuring out what technology works for them, and seeing what capabilities my computer and their computer has, and then just kind of seeing what works. And so then after that first session, then I'll prep families. Okay, this is going to be our schedule for today. Could you make sure your child has this or do that? And so for some of my kids who are more hands-on in occupational therapy, I've actually made some fine motor kits for them. And so I've either dropped that off by their house, or I've had them make something. And so then they'll have that fine motor kit for the session to be ready.
Oh, that's really nice. That's amazing. That's really above and beyond, Kylie, and amazing that you've done that for them. What kind of materials are in those fine motor kits?
Just a lot of things that you can use in multiple different ways. So pom-poms, tongs, just different popsicle sticks to help make letters, just different things like that we can do multiple activities with. Play-Doh is another one.
Yeah, everyone loves Play-Doh. You can use that in anything. That's great. Well, okay, so some families have been curious about the activities that we do for different age groups of kids, and I thought maybe we could look at an activity for an infant, toddler kind of age range, a preschooler, maybe a school-age child or older.
Yeah. So I've been doing teletherapy with all of these ages. So for infant and toddler, and especially with our early intervention program, I would say that's probably been my favorite area to do telehealth with. So I serve a few babies in the area. And so with kids this young, it's going to be more parent coaching. So it's a lot of joint planning of what activities they could do throughout the week. And so if the parent needs to position their child in a specific way, I'll kind of walk them through and give them verbal cues and tell them, hey, try to put him on his knees or try to, open his hands and have him push through with weight on his hands, and I'll coach them through that. And so it's more just joint planning, but it's been really effective so far. And then with toddlers and going into preschool, I've actually been working on potty training a lot.
Awesome.
Yeah, so I just thought, this is a great time, if a child is showing potty training readiness, and since a lot of parents are now home and they have an extended time to work on potty training,
Right.
it's been a great time to work on potty training. So I can show you one of the visuals that I'm using with families. This is from a website called Preschool Inspirations, and it's an awesome, just little social story about potty training and, why the potty is a positive thing. And it goes through just, what the potty training schedule is going to be. And it has some fun interactive times to teach the child, what are some different times we can try to go potty throughout the day. And this has been a really fun resource. I've had parents print it out and try it with their kids.
That is awesome. I had not thought about the fact that kids will be home so much now and with their family, but that you can really set that routine up really nicely for them to succeed with potty training.
I've actually had one family who they've been talking about it for so long, and they've been doing teletherapy for 2 weeks, and he's almost already potty trained because
wow.
they have that time now. So it's really cool.
That's great. Well, so now as far as having siblings in the home, I know you can get to school age children as well in a minute for your routine, for your activity, but how have you been incorporating siblings? Because I keep asking this question of, now all of the siblings are at home and some of them are homeschooling together and trying to figure that out. How have you incorporated the siblings into this?
Yeah, so if the siblings want to join, I think they're a great motivator to come and join for therapy. And so with my preschoolers, I've been playing a freeze dance game or an animal sensory walk game. And so what I'll typically do is I'll have music playing. So I've gotten a lot of Frozen requests and just different music like that. And so I'll either give the child and their sibling instructions to just free dance, or I'll give them like a specific walk that can work with their sensory system. So like they can help each other do wheelbarrow walks. So I'll play the music and then have to do the movement throughout. And then when the music stops, their instruction is to come right back to the screen. And so that auditory cue is helpful with kids knowing when it's time to come back. And then we'll do some instruction. And so I can show you an activity that I've been doing with some of the preschool age kids.
Okay.
Let me pull it up. Okay. So this is a fun activity to work on letter awareness. And so, after they've moved their body some, they're more ready to learn. And so I have just these different deconstructed letters, and I'll say, okay, watch the line types and let me know if you can tell what letter this is. And so with diagonal lines, I usually call them slide lines. So I say, okay, the slide line goes first. I'm going to move it over. So one slide line and two slide lines, and then one side to side line. What letter?
Okay, and then I say, hey, all right.
We've done a few different activities like that, just, breaking up that deconstructed letter and figuring out what it is. So that's a fun activity that we've done.
That's awesome. That's really fun. And now you have school age activity. You have school age children as well on your caseload. What are you doing with those guys?
So this age is really fun as well. We've done lots of different games. I've just done a lot of open-ended social games. So I have this fun activity here. So it's just a random bowl of just different objects. Mm-hmm. Something I've done is I said, I'll say like, hey, so we're going to play a game where we tell a story. So I'm going to show you an object and you're going to start the story. And then I'm going to finish the story. And then we'll tell the story together. So I'll pull out a paintbrush and I'll say, hey, Mr. Paintbrush decided that it's time to go to work today. And then he got his hairbrush and he brushed his hair and he got in his car and he drove to work. So we'll pull like random objects like that and kind of make a story. And to work on memory and just being able to recall a story, I'll then have the child retell the story. So that's been a
fun.
a fun little imaginative story. And so sometimes I'll use my objects, sometimes I'll ask them to go grab objects from their house, and we'll kind of just take turns using our imagination and telling stories. Another area that I've been working on with school age kids are social emotional skills. So I think social emotional skills are a great topic in teletherapy because it's a lot of talking and a lot of just, figuring out like what body cues do kids feel when they're feeling different emotions. So a fun activity that I can show you, let me just pull it up, is, I'm gonna share my screen. Okay, just give me 1 second. Oh, okay. I've lost it. Okay, here we go.
You got it.
I lost the screen for a second. Okay, so here's just a fun activity of something that I've done with the kids. So we've actually used Bitmoji, the app, and I've had the child create their picture of themselves. And so we've picked out just different pictures that apply to different emotions. So this one is an example of an angry mood. And so this is using the program called the Zones of Regulation. And so we've incorporated, just the visual picture, and then we've talked about just different signals that the body can feel when the child is feeling angry. So, wanting to hit or throw, voices moving fast, just different things like that. So this has been a really fun time to work on social emotional skills and just kind of get creative with it and learn more about emotions.
Yeah, I love that you use that very common application of using the Bitmoji. But that's so common. Everybody knows how to use those, and the kids get to create their own Bitmoji and use that.
Yeah, it's fun for the kids to see themselves in a picture form because, just seeing a regular emoji or seeing just a smiley face sometimes won't be enough for kids. So that's been fun to do.
Yeah, that sounds like a really great activity and bringing a lot of awareness to emotions in a time of crisis where a lot of children are probably experiencing a lot of emotions right now. It's good to give them a way to express them.
Sometimes I feel like, with all the things we pack into our day, when we don't have this pause, I think kids are moving too quickly and they're not picking up on those body cues. And so I think, in this slower time, I think it's great for kids to start thinking about, how their body feels and just starting to read those cues.
Absolutely. Absolutely. Okay. Well, my last question for you then is, what is one tip that you could give to parents as far as how they could prepare their child and make this the most effective session for them while we're doing this via telehealth?
Yeah. So I think just, just support your child in whatever way they need. Some kids may be able to do telehealth independently, but, especially the younger ones, I think they need that parent partner there just to kind of support through the activities. Sometimes there's technology issues. Sometimes, it's helpful if, I'm doing the activity up here and then you're assisting your child. And so I think just going into it with an open mind and just being ready to support, and then just asking lots of good questions on how you can carry over the skills throughout the week.
Yes, I think even more in this time, the parent therapist partnership is really vital to the success of this, and maybe even a little bit differently than when it's in a clinic setting.
Yeah, and I think it's a great time for parents just to learn how to be hands-on, just learn from their therapists and ask lots of questions.
Absolutely. And we always talk about how it's what happens in between the sessions that really makes the biggest difference for our kids anyway. So this is a great time for parents to learn and to just get really comfortable with all of this. And they can do this too. Parents, you can do this. We all have confidence in you as well. And we love your partnership with us as therapists as we're trying to continue to help your children and to support you in their growth and their learning. So Kylie, thank you so much for joining me this morning. I really appreciate you giving us the OT perspective on teletherapy and sharing some of those activities and supports for parents and kids.
Well, thank you. Thanks for having me.
Okay, thanks. We'll see you soon.
Bye.
Bye.